I'm Lakshmi Chelluri. I'm a critical care physician for the past 30 years, and I'm practicing at Presbyterian Hospital since 1987. I was interested in patient safety and quality improvement for the past 15 years, and working on improving culture and improving patient safety.
Oh, wow. So, Dr. Chelluri, can you tell me about the concept of the second victim as it relates to medical errors?
Whenever a medical error happens, obviously the first victim is the patient who suffers the harm. But there is an individual or provider who is at the end of the sharp end, who also is involved in the adverse event and affected by the adverse event. And in the past few years, there was a focus on the individual and how it impacts that individual. And we found out that the individual has emotional and as well as a professional impact because of the adverse event. And the second victim is the individual provider who happens to be at the sharp end. And the program is to identify the second victim and provide help.
How do second victims routinely feel after they've been involved in a medical error?
The second victim, there is quite a significant impact, emotional impact, and also questioning of their professional judgment and skills. Many of the second victims report a concern for future performance and possibility of making another error. In addition, they're concerned about their professional reputation and how they are perceived by colleagues. And lastly, they're also concerned about the medical legal liability.
What has the healthcare industry done to try to provide support for these second victims?
As the concept of second victim is identified, there now hospitals are creating programs to help the second victim and they're called peer support programs, second victim support programs, professional peer support programs, where the hospital or the organization trains peers in how to support a person who was involved in an adverse event. And these are physicians or staff who are peers of the person who was involved in an adverse event. And these are provided training in how to listen to somebody who goes through the adverse event and how to provide support to them.
Now, have you been involved in any of these types of programs?
At University of Pittsburgh Medical Center, we are planning on creating a peer support program, and we're working on it in the past few months. The program involves the psychiatrists, physicians, lawyers, and miscellaneous other staff who are interested in providing the peer support. And we are planning to create a workshop for peers and then implement it as a pilot program at Presbyterian Hospital at University of Pittsburgh.
Now, why is this issue important to you personally?
One of the issues reported by the second victims is the impact, emotional impact, and it's long-lasting. Some people remember what happened to them or what happened at an adverse event many years later. And also the impact could lead to drug and alcohol problems, and in this rare event, suicide. So it's crucial. We need to provide support to these people because as all medical errors, no one person is primarily responsible, and nobody comes to work to harm a patient. Medical errors happen because a series of events happen, and unfortunately the person at the end gets sometimes most of the blame, and we need support. We need to support that individual.
Well, thank you so much for your time, Dr. Chelluri.
Thank you.